It's Earle. This is the time I get to spend with you guys and talk about plastic surgery topics. Excuse me. And we are here at Pure Plastic Surgery today. And today, we're going to go over what I like to call BBL nomenclature. So what does that mean? It means like all these words and things that we use around BBLs. And I'm going to try to explain each and every one of them because it can get confusing, right? People are kind of like all over the place with this. They don't truly understand what it means. And so they're like, you know, Dr. Earle, like what's the difference between a BBL and a skinny BBL and a mini BBL and what's going on? I don't understand this lats and hips and slopes. You know, what's happening, okay? So today we're just going to go over all of those terms so we get some good understanding. And then when you have an understanding and you want to describe to me, you know, what it is that you want, then, you know, you'll be able to say that in a much more efficient way, okay? So, first of all, let's just start with what is a BBL, okay? Most people know this. It starts for Brazilian butt lift, okay? And Brazilian butt lift gets the name because it is kind of accredited to a Brazilian plastic surgeon, and so that's why it's called the Brazilian butt lift, okay? That plastic surgeon's name was Ivo Pitangui. He's one of the most well-known names in plastic surgery throughout the world. And he kind of came up with this way back when, like in the late 70s or early 80s, okay? But it wasn't really popular up until very, very recently, probably about 10 years ago. And then after that, it's gone through several changes and several modifications. And so we're going to talk about the other terms. So what is done with the BBL? What is included with the BBL? So what's included is lipo, 360 plus fat transfer to the hips and the buttock. Okay? So that's included in all BBLs. Everything that I'm going to talk after that, just know that that's included. So you're going to have lipo 360, okay, plus fat transfer to the hips and the buttocks. If you want both, you get both. If you want only hips, you can do only hips. That's okay too. All right? Okay, or if you want only buttocks, you can do that as well. All right? So, next term that you hear out there, these were kind of actually the next one after that I put down here, which people started to referring to as the Vixen look or the Vixen BBL. So what is the Vixen BBL? Well, of course, you still get your lipo 360, you get your fat transfer to the hip and the buttock, but you do it in a style where it's a more dramatic look, let's put it that way, where you're supposed to have the waist as small as possible and then really, really big hips. Hips that may be out of proportion to the rest of your body or to your shoulders, and a very, very large buttock with a lot of projection, okay? And sometimes when you're having these Vixen looks, especially back in the day, it wasn't just only hips, you were also getting lots of what they call lats, which is above the hip, which is this area here. And we're gonna get a little bit more into lats versus hips here in a second, but yeah, that Vixen look involved big lats, big hips, as much projection as you could get, and there was pretty much a disregard to the patient's underlying foundation, specifically their thighs. So when we were doing a lot of Vixen looks, yeah, there were some women that could handle it because they had, you know, basically a bigger bony structure and maybe bigger thighs, and they could handle like the big hips and the big buttock. But unfortunately, there were a lot of women that couldn't. There were a lot of women that couldn't handle that, and so things looked like just way out of proportion. Their thighs couldn't handle the large hips and the large buttock, and so then that's where we started hearing terms like ant booties and diaper booties. And that's where some people who don't know anything about this, you tell them BBL, they're like, oh no, that looks terrible, because that's what they're thinking of, okay? But that's not what's happening here today, okay? So after that, we started getting more into what we call your kind of more like the skinnier BBL and the natural or enhanced natural BBL. So now we're getting away from the big lats and the huge hips and projection, and so we're getting to more, you know, doing the transfer in a way that really goes with the patient's unique underlying foundation. And, you know, focusing on filling in those hip dips, just kind of rounding things out, but also making sure the transitions are nice and smooth. Skinny BBL specifically refers to a lower BMI patient. So typically a patient has a BMI, say maybe like between 21 or 20 and 25. Okay, that's what we consider a skinny BBL. So that's a lower BMI patient. But the natural BBL can be any BMI, right? In order to have an enhanced natural shape, an enhanced natural BBL, that doesn't depend so much on your BMI. It just depends on the surgeon and their technique, and that they're basically, taking your underlying foundation into account when, placing and transferring the fat, so that all the transitions that go from the waist out into the hip, back into the thigh, all look nice and smooth, and it looks in a way that it keeps people guessing, right? Where they're like, well, does she have a BBL? Does she not? I'm not sure. She looks fantastic. That type of thing. And that's what the enhanced natural BBL is. And this, of course, can be at any BMI. So skinny BBLs are also looking enhanced natural, but these are for our lower BMI patients, okay? Vixen BBLs today, in 2025, they're not as common. They're kind of fallen out of favor, okay? The next thing you might hear is what's called the HD BBL. HD stands for high definition, okay? So that means that we're now not only just kind of doing your liposculpture and removing fat, but we're also, defining the anatomy, the muscles, or the muscular anatomy of the trunk, okay? Specifically the abdomen. Sometimes you can do it to the back. You can also do high definition to the other areas, such as the arms as well. That's very, very common, okay? And so that's going to be your high definition BBL or HD BBL. And here for women, you have that kind of that feminine athletic look. So you're creating more of the line down the center, the lines here across on the lateral aspects of what we call the rectus muscles or abdominal muscles, okay? You define a little bit of the obliques, which are the muscles that come out this way as well. And you just give the patient that, that beautiful, also natural, but athletic look. In male patients, we can, hey, all of these are for men too, right? It's not only for women. So in male patients, when we do high definition, typically we actually etch out the entire six-pack. So it's a little bit more aggressive there. You etch out the six-pack. You can also etch out those obliques. You can etch out the arms. And you can even add fat to other areas that's not the hips or the buttock. So for men, you can add fat, say for example, to the upper chest, the deltoid or shoulder muscles, the biceps, and things like that to enhance those muscles as well, okay? So that's your high definition BBL. And then more recently, I've been hearing people, talk about a mini BBL. So a mini BBL just means that they want minimal, less change, not as much fat transfer. That's what they call mini BBL. So that's typically, usually sometimes it's like a lower BMI patient as well. They don't want anything too drastic or dramatic. They just want, say, maybe their waist just a little bit smaller and their hip dips filled in, and then that's it. And so they'll call that a mini BBL. And then they're happy with that because nowadays in 2025, we're trending more towards more natural looks. So more natural looks with our liposuction, more natural looks with our fat transfer, more natural looks with the breast as well. So now people are still getting breast implants where they're getting smaller size breast implants. Or sometimes they're just getting a breast lift with no implants at all. And we even have people coming back to remove larger implants and exchange them for either smaller implants or no more implants and a breast lift. And so people are kind of going in that direction in 2025. And we see these trends, right? They change, they ebb and flow. At one point it's more drastic, another point it's more natural, et cetera, et cetera. And a lot of it has to do, believe it or not, with the Kardashians and Kim Kardashian, right? So at one point she wanted to be super kind of drastic and everybody was following that trend, and then she decided she didn't want to do that anymore. She wanted to be more demure, right, if you will. And so she was looking for that little bit more natural look, and so people started following that trend again. And so that's kind of where we're at right now, okay? So those are all the different types of BBL, what those terms mean. And then here at Pure Plastic Surgery, I've developed my own signature BBL. So I had to, of course, put my own name on it, which is the South Beach butt lift. So we're not in Brazil anymore, right? We're here in South Beach. And this name is actually trademarked because it is my signature BBL, my way and style of doing it. and you can only get that here at Pure Plastic Surgery, okay? And so what is the South Beach BBL? Well, it combines a lot of the things here that I talked about, but the South Beach BBL involves an enhanced natural look, okay, where you're gonna have very smooth transitions, okay, anywhere from your waist to your hips to your thighs. It's all gonna look like it belongs. It's certainly gonna keep people guessing, like whether she had surgery, does she not, I don't know, but she looks fantastic. And it's done with less incisions, so minimal incisions, all in places that are very well hidden. So hidden, in fact, that if you're wearing one of those little tiny bikinis in South Beach, you can't see any incision points, right? And that's kind of where the name comes from. So you're wearing a tiny bikini in South Beach, none of the incisions are gonna be visible. And of course, on top of that, as safety has always been my #1 priority, it is done under ultrasound guidance to make sure that I'm placing the fat in that safe space between the skin and the muscle, okay? So that is the signature style. You get your Earle curve, you get my signature upside down heart shape from the back, all right? South Beach butt lift, only here with me at Pure Plastic Surgery, okay? All right, so now let's talk about the other terms that are related to BBL. You hear a lot of people talking about lats versus hips, okay? So when they're talking about lats, and I'm sorry, I'm not the greatest kind of drawer, right? But I think you'll get the point. When they're talking about lats, they're talking about this area here. Like a lot of volume right there. So kind of like the way, if you're looking at someone from the front, the waist comes in and then it kind of really juts out. And that's what's called lats, as opposed to the hips, which are more in their natural location, which is lower in the body. So these are hips. So this is your hips in this area here. And that's the lats up there, okay? And, again, a few years ago, lats were very, very popular, but I think it tended to give still more of like a squarish shape. Some people call it like a wisdom tooth shape, and it's not so flattering. So I think today, 2025, lats are not as popular. And people are going more for hips, okay? Which has always been my style, and that's kind of the Earle curve. When you're talking about the Earle curve, it's about that smooth transition to your hips, okay? So yes, hips are a lot more popular now, and so that is what we're referring to down there, okay? And then the next thing people might talk about is whether they want a slope versus a shelf. When you talk about a slope versus a shelf, that's what you're talking about on the side view, right? So lats and hips is front view. Slope versus shelf is side view, because you're talking about the takeoff of the buttock from the lower back, okay? And so, again, a shelf, and then you have, you can have different degrees, but a shelf is where kind of the lower back comes in and then the buttock kind of just juts out, kind of straight out, just like that. And it's called a shelf because it actually kind of creates like a shelf there, almost like a little table in that area, okay? Versus the more natural slope, where it's kind of a more natural slope, more kind of curvy slope from the lower back into the buttock area, okay? And there's different degrees of this, so you can have your pure slope, you can have your pure shelf, and then in between you can have a pokey slope or a slopey shelf, which honestly, these two are very similar, which kind of looks a little bit more like the one in the middle here, which I think is the best look. So a pure shelf I think does not look good. That's very, very fake look, okay? And too much of a slope, like it doesn't really fit the jeans that nicely, So I think the best is kind of the best of both worlds, kind of in between there, where you want to get your pokey slope or slopey shelf. I prefer the term pokey slope. It kind of rolls out my tongue a little bit better. But that is what I think most people are going for, because it provides, just that little bit of an oomph would be like, pow, like something going on there, right? But it looks still like very seamless, very natural, fits beautifully in those tight dresses and those jeans as well, okay? All right, and then I think that, then the last thing, which I guess I didn't mention here, is kind of how the buttock looks from the back, right? So we talked about the front, which is the lats versus hips. And we talked about the side view, which is the slope versus shelf. And then from the back, then typically you have a couple of shapes here. The one that's my signature shape, and again, I'm not the best at drawing, is kind of that upside down, right? Upside down heart shape. So that's my signature upside down heart shape. A lot of people have copied that since then, so you'll hear other people talk about upside down heart, but that is my signature shape, and it's become very, very popular, and other surgeons are copying it because it's a beautiful, long-lasting shape. It's an enhanced natural look that can last for years and years and years. Okay, so that's that upside down heart shape. Some people like more a little bit of a C shape. You can have a little bit more of a C shape as well. So there's a C shape versus the upside down heart shape there. And those are kind of the options in that area, okay? And then the last thing that I haven't talked about is what we call projection. So projection is how far the buttock comes out this way, okay? So it's also on the side view, just how far the buttock comes out. So then we talk about, how much projection do you want? You want a lot of projection, moderate projection, etc. Okay? And I think that just about covers about every single term you could possibly think of regarding the BBL. But if you guys have heard of another term that I didn't talk about here, let me know and I'll happily explain that to you as well.
Okay, are we ready?
Ready.
Okay, Doug.
Ready for questions.
There are a lot of questions.
I love
so,
yeah.
Where should I start? Okay.
From the beginning.
Okay, that's right. Do you have any before and after of tummy tuck with fat transfer to the hips?
Yes, we certainly do. And so the best way to obtain those, sometimes it's hard to, scroll through the IG and stuff like that. But send us your information. Yeah, send us, go to our website, go to the area where it says start a journey. You can send in, just some preliminary information, and then get a call from our coordinators. They'll reach out to you, and then they can send you some of our examples of our tummy tuck with fat transfer to the hips. This, again, super popular procedure right now because it really brings out those curves when doing a tummy tuck, right? So as part of the tummy tuck, we always do liposuction to the flanks and the waist. That's going to shrink the waist part down. And if you do have some hip dips, well, then why throw away that fat, right? It makes no sense to just throw it in the bucket. We might as well use some of that fat to the hip area to kind of fill out the hip dips so you can have more of that hourglass shape at the time of your tummy tuck.
Ok, en español, porque también hablamos español.
Seguro.
¿Cómo tratan
Claro.
la celulitis en un BBL para que no vuelva a salir en un futuro?
Bueno, el mejor tratamiento para la celulitis se llama ABELI, que es un procedimiento que se puede hacer a veces al mismo tiempo que el BBL o también se puede hacer antes o después de tu BBL. Y es un aparato que ayuda a romper las bandas que causan la celulitis. Y entonces ese aparatico se puede hacer también en la clínica bajo local, o sea que no tiene que ser necesariamente al tiempo de BBL y no requiere anestesia general. Se puede hacer bajo anestesia local en la clínica, un procedimiento bastante rápido, y eso va a atacar la celulitis, va a romper esas bandas, y en ese lugar donde lo trataste con el ABELI, esa celulitis nunca va a volver.
Okay. Thoughts on hyperbaric oxygen
Yeah.
therapy post-surgery, and if you should start the day after surgery, the same day of surgery. Okay,
so overall thoughts. There's typically no downside as long as you're going to a reputable place that knows what they're doing, of course. That's the key thing, right? But given that there is no downside to hyperbaric oxygen, how much does it help? I'm not really sure. If you're in the situation where everything's already going well. Now, if you're in a situation where the skin is compromised or there's some issues, like the skin looks like it's beat up, it's ischemic, it's not getting enough blood flow, things like that, then of course hyperbaric oxygen is very, very helpful in those situations, okay? I probably wouldn't start the day of surgery, but you can certainly start the next day. That's not a problem.
Can you get a BBL, an arm lipo, at the same day, and how long the recovery takes?
Yeah, definitely. So it's one of the things that we can definitely add. I mean, I didn't talk about add-ons here, but with your BBL, there are add-ons, and there's multiple things that you can add on. You can add on different areas, right? So that's going to be like typical areas are like your chin, your arms, your thighs. And then you can add on other modalities to help the skin if you need it, such as body type, or J-plasma, Renuvian, or Baser as well, okay? So all these things are, you can add on at the time of your BBL. It doesn't make your recovery any longer. So for your typical BBL, whether you're doing arms or not, you're gonna have 6 weeks of no heavy lifting, no strenuous activity, no sitting, no putting pressure on the areas of fat transfer, so no putting pressure on the buttock and hips. And then after 6 weeks is when you can start becoming more active, heading to the gym, start lifting weights, sitting, etc.
Okay, Doc, I recommend you to sit because we have a lot of questions.
Okay.
No, I'm just kidding. Well, we have the question everywhere.
Oh, nice.
But this is a nice comment. I need to come to see you for my second BBL. They
right.
didn't make it nice and smooth on the sides.
Okay, yeah, definitely come on down, or you can start if you want going to our website and send in your information through there, through Start Your Journey or virtual consultation. But this is a great question. You know why? Because this is becoming incredibly popular. Maybe I should have added this too here because it's not exactly a BBL, but the round twos, it's what we call BBL reshaping plus minus reduction. So this is becoming more and more popular these days, and not everyone does it. Actually, very few surgeons do it because there can be challenging cases, and we are one of the few surgeons in the entire United States that will actually do this, and what we call a BBL reshaping plus minus reduction if you need certain areas reduced, such as your hips or your buttock if it has too much projection, or if it's just not doesn't look natural. It looks like it doesn't belong. It's not like smooth with your thighs and everything else, right? Like if you had a BBL, I don't know, 10 years ago, and you went for that Vixen look with lots of lats and a shelf, and you no longer want that anymore, then you're gonna have to come back for a BBL reshaping plus minus reduction, so that we can get things to look, as that they look like they belong to your frame, okay? And these are challenging cases, like I said, they're not easy cases, so you need to go to someone who's really an expert in this, who really knows what they're doing and has done, several of these cases. And fortunately, that's me. That's me right here. So if you all there are looking for a BBL reshaping or reduction, this is the place to be.
Doug, are there any vitamins you recommend prior to surgery and post recovery?
Yeah, certainly. Before surgery, we're going to recommend vitamins and supplements that are going to help your hemo levels, your blood levels, okay? So we recommend vitamin C, folic acid, and then an iron supplement as well, okay? And then these you're gonna take, you're gonna start you can start as soon as 60 days before surgery, and then you're gonna continue those throughout for up to 2 weeks after surgery as well.
For a patient who had massive weight loss, would you recommend a lower body lift before a BBL?
Yes. So typically you want to do the what we call quote unquote skin surgery before your BBL. So if you're a massive weight loss patient and most of your excess skin is in the front, then yeah, do your tummy tuck. If you're addressing the breast, do your mommy makeover. But do your mommy makeover tummy tuck first. If you're someone who lost a lot of weight and you have not only excess skin in the front, but also excess skin in the back or the lower back, or saggy skin in the buttock, then you can do that total body lift where it goes all the way around. And yes, again, definitely recommend doing that before your BBL. Once the skin issue has been addressed, everything is tighter, then you can come back and do your liposculpture and fat transfer, okay? And then I know the next question is gonna be, but doc, where are you gonna get the fat, right? That is a myth. That is a myth, does not exist, okay? Because we can get the fat from all the other areas that has not been addressed. We can get the fat from the central abdomen, from the entire back. But we need to go to the thighs, the arms, etc. There's always going to be plenty of fat. Okay, so don't believe that myth. Okay, it is not true. You should get your skin surgery first. All right, do your tummy tuck first, and then come back for your BBL.
Okay, can you do back lipo and a mommy makeover together?
Let me put it this way. For the right patient, you can, okay? But it can't be a patient that's like higher on the BMI scale, okay? You have to be like a lower BMI patient in order to be able to do that, because here in Florida, when we do your mommy makeover, we're limited as to how much fat we can remove by the Florida Department of Health. And the limit is 1,000 cc's of fat removal via liposuction when you're doing something like a tummy tuck or a mommy makeover, okay? And for most patients, if you're like in the, kind of BMI 25 or higher, you have about 1,000 cc's simply in the flanks and the waist, which is what we typically include with your mommy makeover. And so then, there's not a lot more that we can do for you in the back. However, if you're a little bit of a lower BMI patient, right, and so we have more places to go, then yes, we can do some lipo to the back, the flanks, the waist, and then do your mommy makeover all in one go.
I'm 2 years post BBL and I still get tons of compliments on my shape.
Nice. All right. Excellent. And that's great because it also means that you're keeping it up, right? And I always say that the best combination is all three, right? Nutrition, exercise, and surgery.
I had my BBL done by you 6 years ago.
Ooh.
And I'm still so extremely happy with the results.
Nice. So, wow, 6 years. She's dating me now, right?
Yeah, and she looks hot in the picture.
Oh, yeah? With pictures and everything? Awesome. Well, thank you so much. I'm so glad you're still tuning in. I've been doing this Hump Days Lives for, I guess, over 6 years now. We're about to have our 7-year anniversary here at Pure Plastic Surgery. So you must be one of my OG patients. So that is fantastic. Thank you so much for coming on and commenting.
Thank you, Doug. Can alloclay be combined with a BBL and also for a breast lift or breast lift?
Right. So alloclay, so for those who might not know, alloclay is a new basically filler that we have now that is made from, it's fat basically. You can think of it as off the shelf structural fat for volume and filling, okay? And so we've just started using this. We've done our first couple cases to fill in some hip dips. It works really, really well. It does not, the great news is it doesn't involve liposuction. It doesn't involve a big recovery. It does not involve general anesthesia. It can be done easily here in the clinic under local, and it's basically a procedure that has minimal to no downtime, which is great. Can you combine that though at the time of BBL? We have not tried that first. I'm not gonna, maybe it's, in the future once we get more experience with it, we can combine it. But in general, if you're already doing a BBL and we're already doing the liposuction, the liposculpture, for most patients, we should have enough fat to then use your own fat and use that to transfer to your buttock and hips, okay? Now, say for example, you're a very skinny patient, right? A very thin patient with not a lot of fat, and you're having a breast procedure and we need to just give you a little bit more coverage because the skin right here is so thin, then yeah, in that particular case, alloclay is going to be something that we could use just to give you a little bit more volume in that area and get a little bit more coverage for your implant, for example.
We're on time, but there are a lot of more questions. Can we take 2 more at least?
Yeah, let's do 2 more. Yeah, of course. Let's do it.
For Jolly, she said, please ask the question, if you do a BBL, can the fat die?
Okay, so great question. So the answer is some of it will die. We know that for sure, okay? So every time a BBL, not all the fat survives. And so I say this to all my patients. When you do the fat transfer, you're gonna lose approximately, on average, you're gonna lose about 30% of the fat that was transferred, okay? However, the rest, the remaining 70%, it's there for life, okay? So what, the amount of fat that survives, especially after the first 3 months, that fat's gonna be there forever, okay? Which is the great news, okay? And sometimes the survival rate in the hips is a little bit less than the buttock itself. So saying the buttock itself might be around 30%, maybe in the hips it's a little bit lower, maybe you lose about 40% and 60% survives. But still, typically I've had a lot of success in treating hip dips with fat transfer, and it's really the best way to do it. That's the best way to treat those hip dips, unless you have like very, very small hip dips, and then the alloclay is going to be a good option. But if you have significant hip dips, using your own fat, that's the best way to deal with that.
Doug, how long to fly after a BBL, and how many times do you get up on the plane?
Great question. So we are always concerned with a BBL or any surgery. The concern is the potential for blood clots. And one of the most common blood clots is what's called a DVT, deep vein thrombosis, which occurs in the lower extremities, in the legs, in the back of the calf, okay? And so we always want to be very vigilant about that, and we want to try to minimize that risk. So yes, walking is very important, and typically you should be up and walking at least 10 minutes every hour. So, and then the other thing is you don't want to be flying too soon after your surgery, okay? So the minimum stay is 5 days after surgery, okay? So that's why the normal stay is about 7 days in total, because you have your pre-op day, which is the day before surgery, and then you have surgery day, and then you got to be here 5 days after that. So that's 7 days, right? About 1 week, okay? And then after the 5 days, or on day 5, that's when you can fly back home, okay? On the plane, you should try to walk about every hour if you can. But the other thing that we do here for all of our patients at Pure Plastic Surgery is that we want to make sure that we're protecting you. And so we're going to give you a device for your legs. It's called the VenaPro. It's a sequential compression device that helps keep the circulation, the blood flowing in the legs to minimize that risk. And so all of our patients that get tummy tucks, mommy makeovers, BBLs, right, all the bigger surgeries, you're going to get a VenaPro from us, because we want to make sure that you are protected. As we always say, safety is always our #1 priority. And so we do everything we can to ensure your safety. Okay? All right. Okay, everybody. So I guess that is it for today. I hope we got all the terms down. Nobody came up with any other terms. I think we pretty much covered them all.
Yeah.
I had forgotten about the BBL reshaping and reduction, but we were able to get that one in as well. So if you have any of those types of concerns, make sure you reach out to us, okay? To see if we can do something to help, all right? And I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. Take care, everybody. Ciao.